Hi, this is Ellen Madonna again, and we are going to begin Analysis B of Case 1. Now, Dr. Shadar is first going to individualize the analysis, and he's going to ask which remedies of both of the small specific rubrics, 8 and 9, have similar remedies in them. So if you look at 8 and 9 here, the ones that have the same shared rubrics are Rustox and Kelly iodinum. But you might ask yourself, you don't have to take his word for it. I don't. Why didn't he choose rubrics 5 and 7? 5 through 7. Okay. Well, these rubrics are really large, so they're not going to be very individualizing. People who are warm are probably less common than people who aren't, and there are fewer people in the world who are loquacious, but it's not going to help us that much. It's not going to help him that much in this repertorization. So I tried just taking this rubric here, generals lassitude, morning, bed, aggravated, this smaller rubric here, and mind, anxiety, walking in open air, ameliorated, and throat, pain, talking, aggravated. What happens is you get for this one, it doesn't share the rubrics for, it has it for Kelly iodinum. This is the one. Generalities, lassitude, morning, and bed doesn't share remedies with the rubric with Kelly iodinum or with Rustox. Okay, so I always think, oh, these teachers, they're just opportunists. They're just telling you what they happen to find. This is just shopping behavior. But another way to see this is informed strategic planning. He knows this remedy isn't going to help him very much. So he's not, even though it could possibly individualize, but he says, okay, in this case, it doesn't. It doesn't support the other rubrics. So just go on. Don't worry about it. I guess, it's maybe opportunism. I'm not sure. Okay, so this is the original repertorization. And you can see that these big ones here definitely are not individualizing. This slightly smaller one is not individualizing. These three are questionable. And he's asking, what makes Kelly iodinum and Rustox prominent? As you see, you have considered the last two symptoms that have a prominent peculiarity, having modalities, not being common symptoms. There remain two remedies, Kelly iodinum, Rustox. Which of them is the best? Now, I'd like to just stand aside a minute and ask how you learn remedies. When you look at the difference between the two remedies, take some time and answer for yourself before you look at the next slide. Question why. What's different between these two remedies? It's a common homeopathic exercise. And look up both remedies in a small materia medica that you have before you look at Dr. Shadar's answer. You can use your space bar to stop your video and take time to do research or to think, and use your space bar. In a web seminar, you can afford to be luxurious. You didn't pay for a hotel, and you're not competing with the lecturer in trying to figure out what he's talking about as fast as he's talking. It's a very nice position to be in. You can actually think. Now, did you find the same symptoms in your materia medica? Our knowledge of materia medica supports kali iodinum. Now, I think he has all of this memorized, but it's not dependent on that at all. So if you look up kali iodinum, you'll see that these remedies really stick out. I mean, these rubrics really stick out. I don't know. Probably you should use a materia medica that's not too big. I mean, I don't know if I'd look at vermilion, for instance. It's just too big. What I asked myself, why not iodinum? If you go back and look at this repertorization, iodine is right here. It's close to kali iodinum, right? Okay. And really, it has most everything. The only thing it doesn't have is throat pain, talking, aggravated. Okay, so I was I was asking, well, why not? I mean, it's warm. Walking in more open air makes it feel better. It has swollen, indurated glands, thyroid derangements, loquacity, hurried. But if you look at that description and compare it to kali iodinum, pure iodine has a deeper disease. It's more extreme. And if you look on the periodic table, it's in the line of halogens. So the halogens are this pink line here, and here's iodinum. And potassium, kali, is here. So kali iodinum appears to be more mild in my materia medica, and this line here, the kali line, are all organic elements that are part of your body, not down here so much as up here, natrium, kali. This whole area here are just basic elements in your body, nothing very special. But iodine is toxic. So if iodine all by itself is more extreme than kali iodinum, just in a common sense way, you wouldn't be so surprised. Now, Dr. Shadar wants to ask, can we find other confirmatory evidence? Now, the word confirmation is used in Catholicism. It's a time when young people are I guess they study their Catholic beliefs and they are taken into the church. Or it's also used in political situations where you confirm a political appointee. The president will confirm some appointee or judges, that sort of thing. So confirmations support or deny our findings. And when he says, can we find any other confirmatory evidence, we need to think the repertorium virosum is designed to provide a confirmatory method in homeopathy. In other words, it's not our first choice in repertorization methods. We first use the classical method or the standard methods. Okay, there's nothing very different about the way the repertorium virosum works. It's very familiar, but still, we do the classical analysis first. So Dr. Shadar was, he wanted more evidence before he was really sure. He had some evidence, but it wasn't the strongest evidence that he could hope for. He only had 2 really good remedies that just said yes to him. And so he, in his program, he came up with Epstein-Barr. And we'll go over this later on, but he let's just say he came up with this, and he came up with the remedies that are related to Epstein-Barr here. Okay, which is EBV. Now, IM is caused by Epstein-Barr virus. We can look at the manifestations of EBV primary infection as a substitute for the part of the case that has been forgotten by the patient. So the patient has forgotten the symptoms, the useful symptoms of Epstein-Barr, of EBV, or of IM in this case. So he's forgotten that. Dr. Shadar is going all the way back to the cause of the disease of IM, EBV. He's going back to that, okay? So the miasm EBV is a missing piece, and through the repertorium virosum, he's putting that piece into the puzzle. He has most of the puzzle analyzed through the classical analysis, and he's just putting this one more piece using the repertorium virosum. Now, some of you may be asking, why does he use EBV instead of IM? Isn't IM a disease? Yes, IM is a disease, and EBV is the cause, is one cause of the disease of IM. It isn't the only cause, okay? So, infectious mononucleosis affects the eyes, it affects the brain, the central nervous system, it affects the throat, the tonsils particularly, and the lymph nodes. And the lymph nodes go down here, and then it affects the lungs. So there's coughing, and it doesn't really have the liver here, but it does affect the liver. What's this anyhow? More lymph. Oh, it affects the spleen, which is right next to the stomach here. It affects these target places, and this kind of drawing is kind of simplistic, but it's useful, and I'm going to explain a little bit more about this. It's actually more useful to understand EBV than IM. It's easy to remember IM because many of us have experienced it or seen people who have experienced it. So they're both useful, but Dr. Shadar uses EBV. The miasm is EBV. It is not IM. EBV covers a wider range of symptoms than just IM. Okay, so when EBV enters, in the beginning it's just like a little cold, and it goes into the throat in this area, and it can cause problems in the mouth, throat, the nose, and then it affects the B cells. We have two kinds of immune system cells, B cells and T cells. Well, there's more, but these are really the big major ones. And so the effect is it affects the B cells, and they affect the T cells. It doesn't directly affect the T cells, okay? So in this diagram, you don't see the thymus. The thymus is located here at the chest, and it's a big player with the T cells. But the B cells are affected, and all of these organs, the brain, the liver, the spleen, and all these blue dots, they're the lymph system, okay? All of those are affected. And one of the big ways in the laboratory that they know about this is that it is EBV that's causing the problem, because there are other causes of IM besides EBV, and we're going to go over that in a second. One of them is that the lymph cells are killed, and another is they're suppressed. But most of all, what they see under the microscope is that they are deformed. The lymphocytes are deformed. Now, this is actually describing cancer. What EBV does is it does the same thing even if it's just IM. It's just how deep it goes and how extensive the damage is. Okay, so here this is a description of what happens with cancer. But at first it's a much lighter IM. Than it's not something as devastating as cancer. Now Dr. Shadar says, if you consider a presupposed EBD epidemic as the genus Epidemicus and repertorize its landmarks, you will find a set of remedies. They can be repertorized in the Repertorium Virosum software. Okay. Now I'd like to take apart this word epidemic and the word landmark. Okay, in this discussion, because I think you can understand this better if we look at each part of his statement here. The genus Epidemicus is Hahnemann's word, and the remedy that results from repertorizing the characteristic pathological symptoms from any local occurrence of an epidemic disease is called the genus Epidemicus. So it's a remedy that comes from repertorizing, okay? And every local epidemic has its genus Epidemicus, okay? So what this means in a concrete sense is that a group is treated as if it were one patient. In other words, the group's characteristic symptoms are repertorized as if they were one person. This comes from J. Yagar's Homeopathic Dictionary. The remedy epidemicus is a remedy found to be curative in a majority of people suffering from the same disease, as in epidemics. Thus, it is possible to administer the remedy to a vast number of people without taking each person. So Dr. Shadar is saying, essentially, he's doing exactly this when he says EBV is a miasm for this case. But you notice that he is individualizing the case when he uses the RV. He wants to find out what is characteristic about the case. But in contrast, the genus epidemicus is used when the disease symptoms are so strong that they overwhelm the characteristics of the individual. Okay, this is not the situation when we use the RV, the Repertorium Virosum. In a miasmatic case, the individual has adapted to the primary disease state, so his individual tendencies become important. And he, as he did in just what we talked about just now, he repertorizes those tendencies. Why the current disease state is only a partial picture of EBV. If it were the full picture of EBV, or of IM, which was caused by EBV, we might not have a paucity of symptoms. But in this case, the primary infection was caused by EBV, and that's the IM. And the IM partially healed. When after it partially healed, there was a hidden struggle, something that over 20 years, no one knew what the problem was. And then this man, during that time, he adapted, following his own individual tendencies. He adapted to stress, to trauma, to this hidden struggle. He adapted to all of that as he would, given the kind of individual that he is. And what developed was a chronic disease with symptoms that resemble EBV. They're not exactly the same as EBV. The original infection was exactly the same, but the chronic disease has only some of the symptoms because there was a partial healing. So we get the current situation of the patient, and it is not the same as the primary infection. So this helps explain why we are individualized. Now, he uses the word landmarks in his discussion. He says we take the landmarks of EBV. And the word landmark is used in, for example, in discussing the parts of the body. The anatomical landmarks are here. And by knowing these, it's possible to have very different people, and yet you would know exactly where their jaw begins, where their hip begins. All of these parts of the body are all similar, no matter how old or how young or what the gender of the person is. Now, for a disease, do you need to know the landmarks of EBV? Do you need to know all of them? Now, do you need to know the characteristic symptoms of each disease? Do you need to know all about the contagious disease EBV? Or do you need to know the proving of the curative remedy? In general, we don't know these things that well if you don't have a medical background. You don't know all about EBV. And you don't know what is characteristic of EBV. I'm going to talk about it, but I really am not sure. But what you do know is you know your patient. Okay? So you know the characteristic symptoms of your patient. And when you don't know the landmarks, you do know your case. And so you repertorize. All the symptoms should be considered, but those which are more recurrent, confirmed, or more peculiar should be given more value. So this is essentially what Dr. Shadar did, is he gave more value to those things that are recurrent, confirmed, or more peculiar. So this is a very familiar process in homeopathy. So, in conclusion, we have to individualize an RV case. Having said that, it does help to know the miasmatic picture of some remedies. I don't know if he would call, not remedies, but the miasmatic picture of some diseases. Think about remedies. Think about this in the way you know remedies. If you know the polycrest pictures of remedies, you know what kind of symptoms will be helpful. So we all study materia medica. Usually we're trying to sort of memorize each remedy, but my faulty mind is very bad at memorizing remedies. I seem to be able to grasp these remedies over time after seeing enough patients who need those remedies, but just reading materia medica, I'm not very good at memorizing symptoms. But over years of studying these symptoms, I get the idea of what kinds of symptoms will be helpful, just because they're in the materia medica. And sometimes when you're doing a case, you can identify the correct remedy, but that's dangerous, and we always put our prejudices aside and we use our repertory. You do the same with miasms. It's helpful to know what symptoms are like in miasms and what landmarks are like. And when you think you know, it's better to repertorize. But if you know some things, you can quickly eliminate implausible remedies when you have a long list of possibilities. And the same goes for miasms. You can quickly eliminate these contagious diseases that couldn't possibly fit your case. So I'm going to compare EBV to some other viruses. The viruses that are in the same family, I think might be comparable. EBV is a kind of herpes virus. and everyone's familiar with herpes of the mouth and genital herpes. Okay, they all have skin symptoms, but EBV does not focus on the skin at all. So that completely separates it from these other herpes viruses, and they probably would not come up in repertorization. Mumps is another disease that also attacks the lymph area, but it attacks in different parts of the body. So here's a mumps patient and these are the kinds of glands that are attacked. EBV doesn't have the swelling of these glands. I'm not sure if they're attacked even. And then if you have, for instance, metastasis goes down to the testicles for mumps for men. So it attacks certain organs or certain kinds of tissue, both these herpes that attack the skin and mumps, but they're very clearly distinguished, even though they're in some ways similar. So we have herpes simplex that causes mouth sores, and HSV2, which causes genital herpes, and herpes zosters that causes smallpox and chickenpox. Okay, these are all skin problems. Okay, so none of these will come up in a repertorization. But there's a slight comparison with CMV and EBV. CMV is cytomegalovirus. It's also a herpes virus that damages the immune system like EBV. And both cause immune suppression. So immune cells are damaged, essentially. Cytomegalovirus enlarges the cells. So it's cyto, which means cell, megalo, which means enlarge, virus. EBV also deforms the lymph cells. This is how they damage the immune system in the beginning. CMV also causes IM. It causes infectious mononucleosis. And it also enlarges the spleen. But it has many symptoms unlike EBV. Okay, so it's not that hard to tell it apart. CMV affects the development of the fetus and the later development of the child, especially there's retardation and developmental delays. EBV can have X-linked genetic symptoms, but the phenomena is not at all similar. Okay, CMV, you would be checking to see what had happened with the fetus, and usually it might be a child who was brought into you, who's having developmental retardation. So when you're comparing the two, you might look at the organs that are affected. EBV affects the central nervous system. It affects the lungs, but it doesn't affect the GI tract in general. The retina, well, the eyes are affected by EBV. So this, that's a lot of things to memorize. I'm not going to be able to memorize that. Forget that. That's for a doctor. No, I should be more hopeful. So EBV affects lymph nodes and most lymph-rich organs. It's kind of interesting that EBV affects the B cells, and B cells tend to affect the area around in the target area. So it'll have a bad effect in one area, like our patient in case 1 is left with problems in his throat. It's not all over in his body, even though all of these places could be affected. And in either case, any organ could be involved, but from what the little I've read, it seems EBV is really pretty unpredictable. or maybe less predictable than CMV. I'm not sure. So both are affected by immune deficiency from other causes. So if the patient has immune deficiency from something like organ transplant or HIV or even hypersensitivity, maybe, both would be, they would be more likely to be affected. So, okay, now this seems like too much information, I'm sure, but I'm only giving you an idea of what a comparison might be. Hopefully Nader can give us a better description. When you repertorize symptoms in the RV, it gives you a list of miasms, of contagious diseases that have some of those symptoms in the order of similarity. So you want that list. It's your job to compare the miasms in the list, and choose the one that's most similar. So in that sense, you're going to be making a choice. There's a materia medica that's built into the RV, and so you would use that to make these comparisons. But I think it's helpful to actually look in a textbook or on the web and get some idea about the polycrest kinds of miasms. In the beginning, we're just going to look at polycrests, and I think that's all he has on this in this course that we're taking of 20 cases. So if you repertorized the miasms, CMV might appear, but not the other herpes viruses. You would probably ignore your CMV because the entire picture is so different. The patient was a child, and he has a family history of that might suggest that he would have problems of retardation, or the organs involved are the gastrointestinal tract, which doesn't seem to be very important for EBV. Or if mumps appeared on the list because it's also an immune system disease, you would ignore it because the target organs are so different. You don't have swelling of the cheeks or you don't have the testes in EBV. These are probably very limited comparisons, but it gives you an idea of the kind of thinking that you'll be doing. You do the same thing when you are comparing remedies in a list after you've done a repertorization. Now, in case 1, we knew that EBV was the miasm because it most commonly causes IM. But there are some cases when you don't have evidence of a specific disease causing a problem causing the problem of the patient. You have no supporting lab tests. You don't have stories of inherited disease or disease history. Okay. This patient remembered that he had IM, so that was a big clue. But in that case, even when you don't know what the exact disease is, you would still repertorize in the RV if there is a paucity of symptoms. In that case, you'd be looking for possible miasm. And, when you do homeopathic repertorization and you find a remedy, and it says this or that disease resulted, and this remedy cures that disease, and your problem is not caused by that disease, it doesn't really matter as long as the symptoms match. And in the RV, the same logic holds. It's not really based on knowing exactly what the cause of the problem was, what the contagious disease caused the miasm, but it's more a matter of matching symptoms, and if symptoms look like that miasm, even if that really wasn't the cause, you still would use the RV and its choice of remedies. Now, he says that EBV is the epidemicus genus. It's for a contagious disease, for an epidemic. And you have to ask, is EBV an epidemic? And if so, why? Now, immunity to EBV is easily gained in childhood. It's usually some kind of small cold, something that nobody remembers. But if you are exposed to EBV as a teenager and you have no adaptive immunity, that is, when you're a child, you didn't get that little cold that no one remembers, then serious EBV diseases are caused, and essentially they're caused by childhood germ phobia. In other words, the environment is so sterile, so clean, that children can't get these rather normal diseases. These children are living under less pristine conditions, it looks like, and they are not going to be susceptible to adult onset IM. And they are not going to, the IM is not going to leave unsolved problems that lead to cancers, that lead to much more serious diseases, just because their environment wasn't as good as your developed world's environment is. Not as clean. So why is EBV so harmful to adults? EBV causes IM in only 30 to 50% of the cases. Remember that CMV also causes IM, and it is also harmless for children. So CMV is something that's good to get when you're a child. Unfortunately, CMV is very harmful when you get it from your mother while you're in the uterus. So it depends on when you get it also. EBV causes many other diseases that could start with IM. It could start with this little flu that really meant nothing, but became IM because you're a teenager and you should have gotten this disease earlier. Now, allopathy does not try to cure latent diseases that lack simple, clear physical symptoms. So they know, I mean, you find all over the internet that people suffer for much longer than 6 months, which is what the doctors all say on the internet. And this man has suffered for 20 years. The point is that these contagious diseases that are so deeply part of our lives don't kill us. Because they don't kill us, they can persist and they can weaken us, but they persist because we manage to reproduce, and we manage to reproduce people who can be susceptible to these diseases. So why does an EBV infection remain? EBV enters the DNA of the cell, so it continues throughout life. All viral disease infections do this. They all need the DNA of the cell to reproduce. In the case of EBV, B cells are typically damaged. B cells are a type of immune cell, as in contrast to T cells. Okay, B cells are a specific kind of cell, and they're typically damaged. They're misformed. And B cells tend to affect a specific area of the body, so that specific target organs are damaged. You don't find the damage everywhere. Okay, it's in a place. It's in one or a few places. It's not everywhere. Now, where could EBV attack? This is kind of a map of the lymph system, and you can see that it's not quite as extensive as the circulatory system, but these major areas are pretty obvious. One thing interesting about the neck, though, is that it's a very narrow place for all this lymph fluid to pass. And let's see, I read it was something like 80% of the lymph passes through this area here, and the other 20% passes in the areas peripheral. So this area is really, really full of a lot of lymph that's passing through it. You don't have any, it doesn't say that in the books that EBV is particularly, there's a lot of it here, but lymph vessels seem to get stuck around here and here. Just doing body work, you know this. The spleen acts as a kind of a strainer for dead blood cells. And lymph has something to do besides the killing off macrophages, killing pathogens. Lymph also has something to do with fat cells, and fat is the source of energy. So this lack of energy could come from something like that as well, because lymph cells are being attacked. Target organs. Commonly, the first attacked organ is the liver, but also the meninges of the brain and the lungs. Other common organs are the nervous system, the kidney, the bone marrow, eyes, and the heart and spleen. I don't know why the heart is in here, because the heart is not like a major lymph system organ, but it is. And the kidney, I guess I don't know about that. These other organs are very strong, and they have a big need for the lymphatic fluids, and some of them have their specialized lymph cells, like liver and the brain have very special lymph cells. I think the bone marrow does too. Other serious diseases can develop from EBV, specific kinds of cancer, not every kind of cancer, but specific kinds of cancer, and also autoimmune diseases. How did Dr. Shadar identify the EBV symptoms? He says he repertorized the landmark symptoms of a great variety of EBV diseases and associated them with the EBV in his repertory. In other words, he chose the landmark symptoms. And I bet if he were to speak in a symposium of doctors, there would be doctors who would want to challenge him about the symptoms that he chose and that sort of thing. So I don't think any of this is written in stone, and people can probably work on this system that he's made. For sure, I don't know the landmarks of these diseases. They're all this is all new information to me, or most of it is, and most of us homeopaths don't know the landmarks of epidemic diseases unless we're medically trained. But we can use his repertory and the PDF files to do this work. Now, Dr. Shadar says, if you compare this set of remedies with the initial repertorization, the results of this case, you will again see that Kali I is the best remedy, covering both sets with a high rank. So we choose Kali I, and he has an exclamation mark. So here's his repertory. This is what it looks like. Here you might not be able to read the entire list. Kelly-I is here. Kelly-iodine is here. It's pretty far down on the list. It's not the top one. And here, this is the degree of statistical backing. Okay, depending on the symptoms that you repertorized. So if we go back to his original classical repertorization, we find Kelly-I here, right? And he thought Rustox was the only one that had similar strength. Okay, so I made the list so you can see it a little more clearly. And Kelly-I in the Repertorium Verosum is pretty far down. Kelly-I in the classical repertorization is second from the top. Okay, so actually the classical repertorization gives you a good idea, excepting all of these were so close as contenders because there was a paucity of symptoms for the reasons that we've discussed above. Looking forward to seeing you all in the forum and waiting to see how you can point out what mistakes I've made and all the new discoveries that you have made. And we can go on and study this case 2. Okay, thanks. This is Ellen Madono.